A lot of physicians take care of patients with heart failure. Primary care physicians, whether family practice or internal medicine, and all cardiologists take care of heart failure. And by and large, most of those physicians do a very good job of taking care of patients with heart failure. Some patients don't get better, and that's where advanced heart failure comes in. My career is dedicated to taking the patients that don't do as well with standard treatment that helps most patients get better. And we've built a whole team around the treatment of advanced heart failure. And we believe that we have a really important role in serving the community of West Michigan, Northern Michigan, Mid-Michigan, and wherever you want to come from. We have a lot of treatments that we can do for heart failure. The most important ones relate to medicines as well as some lifestyle changes. And we are a leader in implantation of ventricular assist devices in both the state and in the country. We've implanted well over 100 of the ventricular assist devices, long-term ventricular assist devices, since our program started about 4 years ago. We use ventricular assist devices, or the artificial heart pumps, for a few reasons. We put them in patients to keep them alive until they can get a heart transplant. Some patients will never qualify for a heart transplant due to other health conditions that they have, or perhaps they're too old to meet the transplant standards. And for those patients, we can put in a ventricular assist device and we believe help them live a lot longer, but also make them feel a lot better. We also have heart transplant, and most patients are familiar with heart transplant, and heart transplant still is a very proven and effective therapy for advanced heart failure. And we're thrilled to be able to have patients that appear like they're on their last legs, unable to do any activities, really not really living anymore, and bring them back to have real fulfilling life, active lives with these ventricular assist devices, out of the hospital, doing all sorts of activities that would amaze you. So imagine if you can take on the care of a patient that's terrified. They're short of breath, they're tired, they can't do anything, and they're very afraid that they're going to die. Now imagine if you can come in and work with them very carefully and adjust their medicines. And if the medicines fails, imagine if you have a plan B, a ventricular assist device, or even a plan C, which is heart transplant. And imagine if you can employ all those technologies and get them better. I mean, it's really fun to see them back with their families, doing things, patients going back to work. The other side of it, I would say, is imagine none of those things work. It's rewarding also to be able to work with patients and make them realize that they're never alone. We don't ever abandon our patients. And even if they are going to pass away, we're there with them. And we can figure out ways to do that well. But to be honest with you, most of our patients get better. Most of them do well, and that's why I'm a heart failure specialist.